The world embark on ambitious COVID-19 vaccination programs. Governments and businesses are increasingly looking for ways to distinguish between those who have been inoculated from those who have not. And one idea that's been gaining a bit of traction is a vaccine passport. So what exactly is a vaccine passport? Here to answer that question and so much more for us is Stanford University Professor David Studdert. Professor Studdert, thanks for joining us this afternoon.
Good to be with you, Sanaz.
What exactly is a vaccine passport?
A vaccine passport is a certification that someone who has one has completed their course of vaccinations. And it might be in electronic form, like a QR code on your phone, but it also could be in paper form too, like a card that you carry around with you.
Now, I know being vaccinated is something that we're all looking to do, most of us at least are looking to do to achieve that, quote unquote, herd immunity. But we don't know whether a vaccinated person can still be a carrier and a spreader of the virus just yet. Is a vaccine passport somewhat of a false sense of security because we can't confirm whether a vaccinated individual can confirm or can carry and spread the virus?
Well, it could be, and that's a very good point. There still is some scientific uncertainty, as you point out, about whether people who have received a vaccination can transmit the virus without themselves getting sick, affect other people's health. And that would certainly be an argument against them. But I think what many experts would say is it's pretty clear that the risk is substantially reduced. So I think that is being taken as a sign that we should look more closely at this proposition.
I do know that there are some companies that are laminating vaccination cards for this very purpose. And since I'm sitting here making arguments against this vaccine passport, isn't the vaccine passport also somewhat of an issue for people that may not necessarily have access to a vaccine, or, the communities that are hardest hit don't have such a ready access to vaccines as, let's say, the more affluent demographics. So a vaccine passport is also, somewhat useless for them as well.
Yeah, that's a good point. There's a couple of issues there. One is, as long as the vaccine is not widely available in the community, which it isn't and won't be for a few months still, this may be seen as sort of morally questionable, that we would be privileging some people and not others just based on the fact that they were in one of the higher priorities. But even when it becomes generally available, it seems pretty clear at this point that some of our vulnerable communities, some of our communities of color, and some of our poorer communities are going to be more hesitant to get the vaccine. So this would be a kind of privileging that hurt them in a way, and that's something that I think we need to be very attentive to if these programs go forward.
And now that we've been in the pandemic for over a year now, the pandemic fatigue, everyone feels it. Everyone just kind of wants to go out and do what they couldn't do over the last year, obviously be safe about it. But is there an alternative to traveling safely if not a vaccine passport?
I think in the travel area, the case is going to be very compelling to use some sort of certification. We think about travel as slightly different, say, than going to work or going to school, which is essential for almost everybody. Travel is not essential for a lot of people. So it may be that in that area of travel and possibly recreational activities, that we are more willing to consider this kind of proof, and that it may provide some incentives for vaccination that make us all safer.
Well, I know that a lot of locations are requiring a negative COVID test, so a vaccine passport is likely going to replace something like that. Is there anything else that you think is important to note with regard to this development, or I guess this idea?
One thing that I think is interesting is that we've surveyed the general public, and a few other research groups around the country have as well, about what people think about this idea. And it's quite striking. Opinion is really divided, almost exactly 50-50. And it's not divided in the usual way. It's not divided along political lines or along race lines or along rich-poor lines. There just does seem to be fundamental disagreement, fundamentally different perspectives here. And so I think that's going to make it difficult for these programs to be popular. I think it's also going to be difficult for the government to get heavily involved here, because a good part of the electorate is going to be upset about this.
Well, like everything else that we've kind of dealt with this pandemic, everything is new, so we just kind of have to move forward and see what works and what doesn't work. Well, Professor Studdert, we really appreciate your time. Thanks so much for joining us this afternoon.
Great to be with you.